There's some questions we just don't know the answer to. For example, why do cats purr? I asked Smudge, the healthcare hacker cat here, why he purrs, and he didn't answer me. Hopefully, we'll have better results in this week's episode of Healthcare Hacks as we try to answer your questions about out-of-network claims and prior authorizations. Hi, I'm John, your healthcare hacker and the proud owner of Smudge, the healthcare hacker cat. Well, before we get started answering your questions, please take a minute, like this video, subscribe to us on social media. We really want to get our message out. We here at Athos want to tell as many people as we can how to navigate our complex U.S. healthcare system. The first question comes from Karen from Mounds View, Minnesota. She asks, my daughter just had surgery. Prior to surgery, my doctor got an authorization. However, the surgery was still denied and we were left with a large bill. Why did this happen and what can we do about it? Karen, thanks for your question. This is a tough one. I've seen a lot of people struggle with this and end up with large bills when they thought they were covered. What typically happens is you have a surgery done or planned for. The doctor's office calls to make sure it's going to be covered under prior authorization. They may even get a prior authorization, but for some reason your plan has some strange benefits or specifically excludes this type of procedure. In this case, even though it may be medically necessary, your plan explicitly states that this won't be covered. And that's what happened in your case. So what can you do about it? Well, for those of you getting a surgery or a high dollar lab test or radiology test, what I'd advise is ask for a predetermination. That is to make sure that that service is covered in your benefit plan. So for example, what you need is the procedure code your doctor is going to do. You call up your insurance company and say, I've got procedure code X12345. Will that be covered under my plan? Or is it excluded? They'll let you know. If it's not excluded, you got a pretty good chance of being covered. Now, unfortunately, your daughter already had the surgery. This makes it tough. If it's out of network claim, you're in a lot of trouble. The best thing you can do is try to appeal it. You appeal it by, there's usually instructions at the end of the claim or the end of the EOB that you get from the insurance company. Work with your doctor's office or the hospital to try to get that covered. If that doesn't work, look for options with the hospital or the physician, depending on where your bill resides. They might find ways to help you reduce it. If it's in network, I would call your insurance company and ask them why you have to pay this, right? In-network doctors typically have to make sure that things are covered before they do it. So call the insurance company, ask them why it's not covered, and hopefully you can get relief from this matter. Our last question comes from Consuela of Morristown, New Jersey. Consuela asks, I recently had surgery done by an out-of-network doctor. I knew he was going to be out of network but he was the best, and I wanted to go have the surgery done there. I ended up with a much bigger bill than I expected. Why is that, and what can I do about it? Well, thanks for your question, Consuela. That's a tough one. When you go out network by choice, you can often get stuck with big bills, and they're hard to fight. What typically happens is you get balance billed. Now, what does that mean? Well, let's say, for example, we'll use made-up numbers, but let's say the doctor charges $1,000 for the surgery. Your insurance company uses something called usual and customary rates. Usually this is some multiple of a Medicare rate. And they will say, like, say in this example, we'll pay $400. Well, the doctor doesn't necessarily have to accept that $400 as payment in full. They can bill you the rest, in this case, $600. And it can be even worse. If you had your deductible, for example, you could owe the $400 that the insurance company allows, plus your $600, meaning you have to pay the full $1,000. That's why out-of-network claims can be just so expensive. It's that balanced billing component, because a lot of times when this happens, doctors and hospitals charge pretty high rates, a lot higher rates than the insurance companies typically pay, so you can end up with a large bill. Now, there are probably two ways I would approach attacking your situation. The first one is I try to get a higher coverage rate by your insurance company. I try to have them treated as a network instead of out of network. Now, the best way you can have this done, and really the only way that has a high chance of success, is if you can prove there's a gap in the carrier's network. So for example, if you don't have a doctor that does that procedure within a certain geographical distance, say 30 or 50 miles, you can appeal the claim and say, look, I had no choice. This was the only doctor that would do this procedure, near my house. That can be a successful way for the insurance company to do a case rate, a one-time contract with a doctor, and treat it like it's in network. So that's really significantly lower what you'd have to pay out of network and out of pocket. The second option is to work with a provider's office and try to lower what you out of pocket. What I find is a lot of times when a doctor or hospital are passing on charges or balance billing an individual, the charges are astronomical and not really based on anything. So I try to negotiate and push back on the doctor's office or the hospital, depending on where the bill resides. Try to base it on some sort of reality. Come back with an offer. I, for example, use a resource called Fair Health. I'll put a link in the description below. But Fair Health allows you to price procedures in your area, in your zip code, by in and out of network. It's kind of the average price. That way, you can go back to your doctor and say, look, here's the average price. Will you be willing to accept that from me? They may or may not. And unfortunately, especially if you sign something up front, you may be on the hook. In that case, my recommendation is get onto a payment plan, pay on time, and then after a certain amount of time, say 6 months, try to do a one-time settlement where you reduce the amount that you have to pay and not the full balance. But that's really the only two options you have, unfortunately. Well, only 2 questions this month. I hope that you found these helpful and useful. If you have any questions or comments about this video or any other healthcare or finance related topic, please leave them in the comments below and we'll try to address them in a future episode of Healthcare Hacks. And again, as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.